With us now is Dr. Sarij, and we are at his beautiful medical spa called Evolve Medical. And if I'm glowing, it's because I just had my face done here. Lovely. How are you today?
Well, thank you and welcome. And I'm glad you enjoyed the facial. You look glowing.
I appreciate that. It's all about regenerating my cells. So what type of medical specialty do you provide here? Regenerative medicine.
So, a good question. Not many people are familiar with the word regenerative medicine because it's one of the newest things. Regenerative medicine, just like it sounds, you are regenerating cells, you're regenerating tissue, you're regenerating even organs. So that is the gist of what it is. But of course, there's a whole more to it.
So many things like, oxygen and things that, we're depleted from. You're able now to celebrate somebody's body by reintroducing things that are already naturally in a person's body, but now you're helping create an environment where that happens. I saw some of the equipment you have, which is absolutely like beyond. It's almost like space age odyssey things. So I know you've really taken your time to research all the equipment that you have here so that you have the best of the best. So how do some of these things work, and why is it to the human body like so almost like replenishing? How is it that it's regenerating something that's already in you, but like taking it to the next level, bringing back what you've lost almost?
Right. Good question. And a good example of something that you've lost would be a person who's a diabetic. So the key to this is oxygenation and getting rid of the carbon dioxide waste. Now, if you're lacking that vascularity, we can expose you, and I'm not limiting this to that extreme example of a diabetic. What you're doing with hyperbaric oxygen, 20% of the air that we breathe is usually oxygen. Now, you're going to be getting 100% oxygen at a very high barometric pressure. So it's pushing it into your tissues down to the very smallest end. It's compressing it and it's pushing it in. So oxygen, without oxygen, there's no life. And with that oxygenation, there's going to be angiogenesis, which is the formation of new blood vessels, very tiny blood vessels. And the rest, you can pretty much see there's going to be a process of regeneration. You will see new skin form. You will see the area, just the wound closing, and all from a hyperbaric chamber.
Makes you happy, doesn't it, to be able to help people? I guess that's probably why you went into the profession in the first place.
Absolutely,
right?
Absolutely. And one of the main reasons probably that I started doing more of this, because I'm trained in internal medicine, and I'm also trained in interventional pain management. I became more interested. One, I'm reaching my middle age, so that's the anti-aging part, right?
Yeah. Me too.
Right. So that's when you start thinking about it. You're not going to think about it when you're 20 years old. You're going to think about it when you're, a little older. And two, the allopathic medicine, regular medicine, using insurance and so forth, doesn't give you the ability to try a lot of these things that are considered experimental. But we have years and years of evidence, decades, for the things that we employ here. And I can give you other examples of the things that we have, some of the other things that we have here.
Well, I know you have like a red laser machine here. You have so many different modalities, right? So what are some of the things that you're able to do now that you have this medical spa and you have this great, these tools, I guess? It's like it's your brain, but it's, you're able to use the tools to make a difference.
Yes, and I believe you're mentioning the red light therapy.
Yes.
So it's important to understand red light therapy. There's been so many decades of research on red light therapy. essentially, the best way to think about red light therapy is to think about, the analogy would be, let's say you're having an apple. There's not just one vitamin you're going to get from the apple. The apple is full of different vitamins, minerals, there's fiber in there, all these different things in the apple. So the same way the light that we get from sunshine, that light has a whole lot of bandwidth within it. Some parts of it can cause cancer. Some parts of it are responsible for photosynthesis. Some part of it is responsible for the fact that you manufacture vitamin D. Well, there's a part that produces red light, but this part has been studied well, and we have found out that it increases something called ATP, adenosine triphosphate. So what is adenosine triphosphate? Within our bodies, within our cells, we have little generators of power called mitochondria. They have other functions as well. Mm-hmm. So now, the mitochondria produce the electricity, the energy that we utilize to do everything. So a cell that has more ATP, adenosine triphosphate, is a cell that has a lot more gasoline, has a lot more energy, solar power, whatever you want to call it, adenosine triphosphate. Either we can have more mitochondria, which is not something that we can do, not as of yet, or we can make these mitochondria produce more ATP. And this is exactly what red light therapy does.
I always wanted to invent something, doctor, where I would stick my finger in something and it would give me the same experience as 8 hours of sleep, right? And I was in my 20s. But now all that type of technology, it's here, right? Because just like the name of your, here, your medical spot, it's evolved, right? So I guess you've taken the time now to research it so that you can bring it to all your clientele. It is really fascinating. And mitochondrial DNA is how we find out how we're related to one another. I did the Ancestry.com, I did the 23andMe, and it's amazing how much information when you're able to take the human body, combine it with your knowledge of medicine, combine it with technology, and then the result is like really spectacular. Have you seen a couple of things where you've even been wowed yourself? Like when a client's come in, whether it's your pain management practice or whether it's here, where you said, wow, I'm so glad I do what I do. Like, what have you witnessed? I thought that was interesting about the person's lesion healing. But what else have you seen?
It's, yes. The advent of the regenerative medicine and the coming of platelet-rich plasma and stem cells, these type of things, it really is astounding. It's really amazing. Now, there's so much that we don't know. Now, if you inject the regenerative medicine products, it's going to do something that's completely different. So when I saw that first, happen, in fact, my first patient was a gentleman that was having knee pain, bilateral, both sides, for years, and I was injecting him with a steroid, the traditional. He was coming back 3 months later, 4 months later, maximum 6 months later. And the gel injection that I was telling you about, that's a series of 3 to 5 shots depending on which brand you use. So I injected him with some stem cells and platelet-rich plasma, and then I didn't see him. He was my first case, and then I didn't see him. So I thought, God knows what happened.
Right, you were concerned about him, right?
I was concerned. I was concerned.
Where is he?
So he returns to my office about 3 years later. 3 years later, he comes back to the office. He says, Doc, I'm starting to have some pain there again. That was fantastic. Yeah, I'm thinking, okay, if mine goes bad, I have something there.
Right. And you know what? And
Yeah.
there you go. Like you're
Yeah.
trying new things. You're seeing good results.
Mm-hmm.
You know, I saw good results just from the facial. You still do some traditional things too, right? You do some injectables. You have a couple of nice, really good product lines that you're working with. You had also mentioned to me maybe you have a vitamin I should maybe take that'll help me.
We do.
But it's like, you know, head and shoulders, knees and toes. And you're right. I think no matter where you are in your journey, it's important to, I guess, protect your assets, protect the assets of your body. People do it with their finances, but rarely do we ever like really take very good care of ourselves. So.
Yeah, well, so we call it regenerative medicine and anti-aging. Now, here's the thing. As you know, the average lifespan of Americans has increased over the years. In fact, the average is 74 for men, 76 for women. There was a little drop on the average since COVID came by, I believe, a year. That's just, you know, the 1 million people that died. Yeah. So the rest of us still aging the same. However, what's key is that the increase in longevity has not come with increased period of having good health.
Interesting.
All right, you're alive.
Right.
You're alive, but
the quality of your life.
What's the quality?
Right.
Yeah. So, what we want to do is match those two. We need to not just live longer, but also live healthier and have the sort of health where you actually can do things, go on those vacations that you wanted to always go, and now you can't because
you can't get up the
your
steps
knee
in
is,
Philly, right?
Yeah, it's ridiculous. Yeah, but we do have a full gamut of things, like you mentioned. We do have. We want to. There's also the aspect of looking less aged on the outside.
Yes.
And the process of aging, what it does is we lose fat on our face in places we don't want to lose fat. So that's a big part of why we look older and we look more wrinkled, etc. Because we just have loose skin now. And there's plenty that can be done about that. And we do them. In addition to that, as far as regenerative medicine is concerned, the skin, in fact, is the largest organ in a person's body.
Absolutely.
It is,
right. And I do the same thing. I tell people, I'm like, do you realize your skin is an organ?
It's an organ.
Right. That's why I said to you earlier when we were off camera, I am trying to be mindful of drinking more water. Just stay hydrated is key one. Right?
Absolutely. It's the key. It's our defense to the outside world. So there's a lot of regenerative medicine procedures, techniques, technology that's coming to do the same for the skin as it's doing for other things.
You even have like a hydrofacial here. There's so many things, you know, that I guess if somebody wanted to learn more, they could go to the website, they could kind of, you know, call here, get a consultation and say, okay, you know, evaluate my body, right? From my head to my toes and fingertip to fingertip.
Yes, the hydrofacial it does a couple of things. One of the things that it does, depending on the machine you're using, as you get older, the lymphatics, which are also present in the face, they are not draining as well. So that's why you see puffiness in certain places.
Interesting.
So,
like when somebody has breast cancer surgery and they lose their lymph nodes, why they have the swelling in the, is it called lymphedema?
Correct, yeah, lymphedema.
Okay, and you can get that in
you
your
can get
face
the same thing
because
in
of drainage.
So yes, as you're doing that,
that's like
as
awesome.
you're doing that, it's also draining your face, draining into the lymphatics. So it's not just increased fat in certain areas, but it's also lymphatics, actual swelling, etc. So yes, we try to
come here and hang out with you like every day because A, I want to live to 100. B, I'm halfway there, and even myself, I had been in a car accident which made the carriage of my head, like where my
whiplash
Right,
injury.
exactly. So that's why I have like this a little bit, right? So usually my makeup artist will like make me have a chin line, but it also could be like I don't have good drainage, right? So somebody could actually come here, get educated, and you could kind of help them.
Right.
I think we all need a little help at some point
Yes.
in our life.
We have many tools in the toolbox here, but each one of them is a tool.
Okay.
Amazing, so promising. So that's what excites me about this, all this.
Having hope, right? Having hope, and then trying things and seeing how it happens.
Trying things, doing new things. Another very exciting thing in the world of regenerative medicine is something called CAR T cells. Have you heard of CAR T cells?
No, but let's finish on that. I'm interested. Tell me about that.
To date,
right?
we were fighting cancer with chemotherapy and things like that. Well, we're going to be, in the future, hopefully, we're going to be fighting cancer in a completely different way.
Okay.
We are regenerating cells from your own body, T cells. We are making those cells recognize the cancer cells. We're growing those cells into multiple and re-injecting it back, and they basically go back. It's your own immune cells. They attack the cancer wherever they are, and they destroy them. Zero side effects, zero. You're fighting it yourself.
In our industry,
Yeah.
right? In our industry, sometimes when I'm filming, like the air conditioning unit goes on, right?
Mm-hmm.
And we have the technology, and I know this is like certainly not as exciting as curing cancer, but I understand what you're saying in a practical way, even for ourselves, because I can say to the editor, I'll be like, okay, I need you to eliminate just the air conditioning sound and remove that, but let everything else remain. And it works. It's amazing. Because I'll get so frustrated. I'll be like, I hear this, right? And you can't have good television without having good audio and video, right? You need both, right? But that's fascinating to me that they're doing that in medicine too, because in a practical way, I get what they're doing. I get it.
Oh, absolutely.
That's amazing.
Absolutely.
Yay!
We do some stuff that, and if you want to relate it back to aesthetics and anti-aging, of course, if you fight someone's cancer, that's going to increase their age because they're going to survive. But we treat, for instance, psoriasis. Right? We have a very high-tech laser machine that actually can treat psoriasis or fungal infections. So in the case of psoriasis in the future, because psoriasis is an autoimmune disease, we will be able to fight psoriasis with something similar to the CAR T cells that I just described to you.
Thank you for inviting me here.
That was going to be a game changer. Thank you for
Sincere
coming.
pleasure. Thank you for sharing your expertise. I know we were just going to sit down for like a short while, do a brief interview. I found your information so fascinating. I'm going to air it all. I think that it was such a nice time to sit with you to get some great insight about like what's happening in modern day medicine and things that we can do to make our lives better, make the community's life better, right? Plus I heard that you are a pretty good pickleball player.
Oh.
Any tips on that?
Absolutely, yes. That's been my latest passion. I partially attribute it to the middle age crisis, but it's growing at a rate of 12% annually in the United States. So it's overtaking
Stay active,
tennis.
right? Stay active.
Yeah,
So
absolutely.
We
Anytime.
hope you enjoyed our visit, and maybe you'll want to call and get some pickleball tips. But I find this information fascinating, and I'm so glad you joined us on this journey. And stay tuned for more. We've been living it up right here at Evolve Medical Spa.